Hi there, welcome to Mansfield today. It's a Wednesday and that means it's time to look at matters medical with Dr. Vicky Skitter.
Hi everybody, it's me again, Dr. Vicky Skitter for the Medical Show, and recently we had World Allergy Week. That was quite interesting. So they talk lots about asthma and, I've spoken about asthma and how asthma should be treated. But one little thing that gets left behind, or one disease as we can call it, is rhinitis. And that's inflammation of the nose, or like hay fever type things. I always call it asthma of the nose if I want to explain it to patients. Rhinitis affects as many as 16 million people in South Africa. 40% being children, so it's really common. Asthma and rhinitis go hand in hand. In fact, we often call it the united airway. Some might say your chest starts at your nose. And the reason is the lining of your nose is very similar, almost is the same as the lining of your lungs. And they basically do the same thing. So they both transport oxygen in and out of the lungs. And it's also a defense against unwanted foreign substances or infections. So that's why we call it the united airway. So basically what happens in the nose can often cause problems further down in the lungs. In fact, the statistics show that 20 to 40% of patients with allergic rhinitis also have asthma, and 30 to 80% of asthmatics also have allergic rhinitis. So that's quite interesting. So rhinitis is actually defined as a reaction involving the immune system to things which should be harmless, mostly aeroallergens like dust, pollen, animal dander. The eyes are often involved as well, so you'll get itching, sneezing, runny nose, blocked nose. The eyes will be red and also itchy and tearing. People can think hay fever is not so serious, or rhinitis, but it can affect your quality of life. So it can be seasonal, it can be perennial, which is right through the year. It can also be just intermittent, like less than 4 weeks. Usually that's to do maybe with plants or flowers in your garden. So when I listened to that one doctor talk about rhinitis, she said something very cute. She said, rhinitis should not be sniffed at. So we must take it seriously. I thought that was really cute, because if severe and untreated, it can cause debilitating physical symptoms. So, for example, it can cause severe sinusitis, middle ear infection, otitis. Asthma can worsen. That's often. Poor sleep quality. And when kids don't sleep well, it causes emotional problems, problems at school, problems with their performance in sports, adults as well. And imagine now you're a presenter, or imagine now I was sitting like this and I was talking to you like this, and that will be very embarrassing. So if you're like, working at TV or whatever, it can be a big problem. So the treatment, you can try and prevent exposure. That is hard though, because how are you going to prevent, dust, pollen, grass, and sometimes animals is also difficult. You visit people and they always have animals. But the pillar of treatment for severe or persistent allergic rhinitis is intranasal corticosteroids. Is that cortisone nose spray? Other treatment would be an antihistamine, obviously. Then you get Leukotriene Inhibitors. Asthmatics might know, like the drugs called Singulair or Montelukast or Monti-Air, those things are common. Those are the Leukotriene inhibitors. There's obviously pros and cons to all. So the corticosteroids, the pillar of treatment, it acts on many levels. It's brilliant, but it takes 3 to 6 hours to start working, and you get the full effect only sort of between 2 and 4 weeks. It is a regular daily treatment, so you need a motivated patient. That patient needs to use it every day, and that can be a bit of a pain, but it's definitely worth it. Then the antihistamines obviously act on the histamine release. It works very quickly, which is nice, but it doesn't have a sustained anti-inflammatory property, so it doesn't last too long. It's good for itching and sneezing and runny nose, but it's not very good for the blocked nose. Now, the Leukotriene inhibitors or antagonists, those ones that I mentioned, They've also got a rapid onset of action. It acts on the nose and the chest, so asthmatics really benefit if they've got asthma and rhinitis. It's good with a nasal blockage, but not so good with the itching and sneezing. So, every drug sort of works on a certain point. And the side effects of leukotriene inhibitors sometimes can be like sleep disturbance or vivid dreams, but 95% of people are fine. So to choose your best treatment for yourself, because you can actually buy over-the-counter intranasal steroid sprays as well. Over 70% of patients with moderate to severe rhinitis will need multiple therapies. So not just one little antihistamine. You'll need to sort of choose wisely. So when you have to decide on treatment, it can be tricky. Most 70% of patients with moderate to severe rhinitis actually needs more than one medication. You can also, colds and allergies aren't often very easy to tell apart. So both allergy and colds, for example, causes itching and sneezing and blocked nose, runny nose. A cough is common. A cold can last up to 3 weeks. That can also make you a bit confused. Young children can develop 10 to 12 colds a year when they're in creche. So we call that creche syndrome, and that can confuse everybody. And infection can also aggravate rhinitis or make the asthma worse. So they're all interlinked. The unique features of a cold, the basics, is like a low-grade fever, lethargy or tiredness, achiness, clear phlegm to start, and then it turns to opaque, even yellow, and it often sweeps through the family. So Boetie gets it, and then Sissy, and then mother and father. And in between these colds, they're usually perfectly healthy. So that might help you to distinguish. There are some truths and myths about allergies and allergy medication. When COVID started, all those patients that had allergies and asthma were very worried because it was said that they were more prone to get COVID seriously. That's actually a myth. In fact, there's certain studies that shown that it might actually be the opposite due to studies done on biomarkers and receptors. But poorly controlled allergic rhinitis can actually be a risk, because now you've got a patient that's irritated with a mask, touching the nose, rubbing the nose, fiddling with the mask, and perhaps that can increase the transmission of the virus to self or others. Then only take allergy medicines when you have symptoms. That's not completely true or symptomatic. It's shown that allergic inflammation is already present before symptoms start. That's why it's so important to use that corticosteroid nose spray all the time, even if you're feeling fine, Another one is when you use a certain brand of antihistamines, it will stop working because you get used to it. There's no evidence of that, so that's not really true. Inhaled cortisones can be dangerous. That's the other one. Actually, it's the safest and most effective medicine known if you use it at the correct dose. So that's important. The absorption is minimal if the dosing is done properly. And young children can't get tested for allergies until they're 2 to 3 years old. That's not true. You can actually test for environmental allergies accurately from the age of 3 to 4 months. That can help us differentiate between allergies and infection or colds. And the last one is pets. If someone wants to sell you a hyperallergenic pet, because their hair is short or not long, or I don't know, it's just maybe no hair. There's no such thing as an hyperallergenic pet, because you're actually allergic to the pet dander, not the hairs itself. So keep that in mind if someone wants to ask you a couple of grand for a special pet. I hope this gives you a good overview of the rhinitis, and I will see you again next week. Bye.